Gujarat has been witnessing increasing number of heart attacks among youngsters and deaths as well. Today we have with us Dr. Tejas Patel, a noted cardiologist and Padma Bhushan awardee. Welcome to Vibes of India,
Thank
sir.
you very much, Nana.
Dr. Patel, tell me the reason what is behind the number of heart attacks among youngsters and often resulting in deaths. I mean, we have been witnessing it of late.
I agree. Let me tell you, this pattern I have discussed even before with couple of journalists in the interviews. That when I was a student, that is medical student, way back in early 80s. Anybody who is coming, below the age of 60 were considered, something unusual and young heart attacks.
Yeah. Okay.
Then I did my MD medicine from 85 to 88, and early 90s I became cardiologist in 91, 92. The pattern already started changing. We started seeing patients coming below 50 with heart attack.
Okay.
In that decade. In early 2000 to late 2000, first decade, we have seen that the whole paradigm shift from 50s to 40s.
Okay.
Yeah, I mean between 30 and 40.
Okay.
And after that, unfortunately, now I am not surprised. Even a young gentleman with the age of 35 or a young lady, aging 31, 32, or 29, coming with us with a heart attack. It is a very, very disturbing phenomenon. Uh, if you see, there is a paradox.
Okay.
Paradox in a way that when we were children or adolescent or college going, we did not have that much concept of health awareness, exercise, these and that. We used to play outdoor games, these and
Right.
that. But formatted exercise regime, hardly few, maybe practically none of us followed. Nowadays, in young generation, you see there is a lot of awareness. They want to look good. They want to look, fit. So girls and boys, they go to the gym. They do some cardio, some resistance training, everything, and they take help of trainers and everything. Then why? Fitness is there. They have become aware about their eating habits also. We were not, frankly.
Right. Right.
Still, the things have increased because probably peer pressure of performance and stress.
Okay.
That is one main reason. Lot of bad hormones, accumulate in the circulation and they constantly irritate the heart. And even the borderline fatty plaque can rupture and lead to sudden seizure of the blood, occlusion of the artery, and leading to heart attack. That is one reason. And that peer pressure of performance is not only in the affluent class or amongst the students, every spectrum, every walk of life. Even a rickshaw driver has the same pressure, or even a lorry driver or a middle class gentleman,
Right.
even a person who is doing a regular job, or an industrialist or businessman or a doctor or even journalist. We have seen
Right.
from all walks of life patients are coming. So peer pressure of performance seems to be a major reason. At that time, India was not even considered a developing country. It was, a sort of a real third world. And
Yeah.
people were at ease. At least they were having good peace of their mind overall by and large, which is not there now. Practically with everybody. Everybody from morning to evening, they think that what next, what next. That is one. Secondly, diet habits, they want to eat good, but they indulge a lot in new generation.
Okay.
In our times, by and large, once in a while, at least I know most of us used to go to some restaurant or used to eat outside. Normally, morning breakfast or maybe lunch we used to carry to the school or college, we used to ask for the tiffin from home, and dinner also homemade. So by and large, the things were pretty streamlined at that time, although
Okay.
we might not be receiving completely balanced diet.
Right.
Nowadays, they want to eat healthy, but they indulge a lot. It
Okay.
means that in between, some friend comes and they think that, okay, let us have good cup of strong double shot espresso, this and that, or some aerated drinks, pizza, these and that, all those things. Even in the regular, modest middle class or lower middle class, also you see all these food joints and everything is full in the evening in Ahmedabad
True.
or across the board in Gujarat. So it means that unknowingly people are consuming a lot of simple carb and
Okay.
trans fat, which are the worst for the arteries of the body, right? Starting from the brain to the toe artery, and that doesn't spare even the coronary heart arteries.
Okay.
So there is a accelerated process.
Okay.
Girls, it was practically unheard of in our times that before menopause, a woman coming with
With a
heart
heart
attack,
attack. Okay.
which is not, which is very, very, it is not true now. Young female, and the reasons, there are studies which have shown that smoking is one of the factors.
Okay.
Unfortunately, it is a very sorry state of affairs that smoking in male has gone down, but smoking in female, particularly in
Has
young
risen.
generation, has increased remarkably. And as a doctor sitting on my chair, when some young girl comes with some complaint, I don't hesitate asking that, do you smoke?
Okay.
Otherwise, in our time, the girls would have offended. They have felt offended. Why is he asking me about smoking? But it's not, it's common nowadays. And it's a fashion statement, I think, which is bad.
Okay.
Tobacco is extremely bad.
Okay.
And a lot of other things. All these factor, bad eating habit, sleeping sleeping issue, and those young guys who want to make muscle and look handsome, they are at times indulged into androgenic steroids and all
Okay.
those
Okay.
injections, which is not good.
Okay.
Up to limited amount of consumption of protein powder, I don't mind, because if you do a lot of weightlifting, there's a lot of muscle breakage, and you have to have first class protein which you get. But
Correct.
again, not as per the western recommendation. We have to design our protein requirement as per the South Asian population's digestive
Okay.
capacity and overall body capacity and metabolic system.
Okay. But doctor, the reasons that you said should be true for all across the country, then why do we see so many cases in Gujarat?
No, no, no. It is there everywhere,
Okay.
across the board in the country.
Okay.
Because in all our conferences and workshops,
Right.
I interact with
Okay.
my peers from all the different states,
Okay.
and they say the same. Forget about it. I travel internationally, across the board, not only in South Asia, across the board in Asia, Europe, and US. There is a paradigm shift
Okay.
in the the age pattern and the heart.
Doctor, COVID did play a role in affecting various organs of the body.
Yeah,
To what extent heart has been affected?
it's a very good question. Let me tell you, during COVID time, this place, Apex Heart Institute, was probably the only dedicated cardiac place which had worked only for the heart patients.
Okay.
Heart patients without COVID, and even all those acute heart attack cases, even with COVID, we are keeping in. We used to keep them in isolation and we used to work.
Hmm.
The pattern in COVID, what we have seen, and I have discussed it in many forums also, and in many interviews also, that patients were discharged after recovery from COVID from different hospitals. They used to go home, they were feeling fine, and normally between third and sixth week, suddenly they develop chest pain, this and that, and present with the heart attack.
Right.
And they used to come to us, and when we used to do NGO, and that is again across the board in the spectrum from 20-25 year up to 80-90 year. See, the most important thing which we used to see is, even in young patient, everything looks clean, but there is one blood clot
Yeah.
sitting in one part of the artery leading to the heart attack occluding. You remove the blood clot and the things used to become normal. So it was a COVID process which enhanced the development of heart attack, which stimulated the process of heart attack, and not per se the fat development, accumulation, and the rupture in that fat leading to the rough surface, which is a classic mechanism of development of the blocks in the
So
heart.
has the side effect still continued even after 2 to 3 years?
I don't believe that. I
Okay,
frankly don't believe
okay,
that. And the COVID vaccine also, people blame that that is the reason. But I have again, I'm telling you that you don't have any such data. This is
correct.
simply an hypothesis. And
Right,
I personally feel that we are alive because of at least two doses of COVID.
right.
Because you see the first world country like US, where the conservative Americans refused to take COVID vaccine, and what happened in those
Right,
areas,
right.
there was massive casualty. At least the government has done a tremendous work on this, and that needs to be applauded.
Doctor, do you recommend any particular test to be done yearly to know whether your heart is healthy or not?
Regular checkup as per the guideline. You don't have to go for angiogram, this and that. But if, like, a person in late 30s or 40s or 50s who is otherwise healthy and he wants to get a checkup, but in the history, if there are multiple risk factors, diabetes, blood pressure, that the lipid levels are high,
Right.
smoker, stressful life, and most important, strong family history of sudden cardiac events happening at the age at or around the same age, then I would recommend that at least they should go for CT scan, coronary calcium score, plus minus CT coronary angio,
Okay.
because completely asymptomatic, other reports are normal, ECG, echo, everything, then subjecting them for angiography is not in the guideline. It is unethical. But this is a non-invasive test which is done on outpatient basis, and that picks up by and large. If the calcium score is very high,
Right.
then we can very confidently tell the patient that fine person that you should undergo angiogram. There are high chances. If like calcium score is zero, then as per the evidence base, chances of that particular person, a male or female with a zero calcium score, uh, chances of that particular person developing any coronary event down the line in next 5 years are 1 in 1,000. So
Okay. So,
that particular person is practically immune. So this is a good information.
right. So, how often one should undergo this test?
That is not to be done on regular basis. At
Okay.
least you should have this, or else patient who has vague symptoms in the upper half of the chest,
Okay.
or upper half
Okay.
of the body, and again multiple risk factors. Oh, this thing should be done, because angina traditionally, there, people believe that it's a central pain in the chest or in the
Yes,
pain in
I
the
was coming to
precordial
that
region,
question. Yes.
but you don't get every time the classic angina presentation. More so in diabetics, the
Yeah.
pace the picture is completely distorted most of the time. And even otherwise, acidity, they
Right.
feel like the heart attack or proper circulation problem happening in the lower wall of the heart will lead to acidity type of symptom. Back pain, the posterior wall of the heart may give the muscular pain in the back, sometimes the left shoulder pain, and sometimes one person walks or climbs the stair, person has jaw pain and throat pain, and person feels that okay, I have some dental problem or I have some ENT problem, and they get them checked
Yeah.
and all those
Okay.
things. But no, this at that time one should consult the family physician or MD medicine doctor if available, get a regular cardiogram, troponin test, this and that done. If everything is fine, then echo ECG, plus minus treadmill stress test, and if that is also all right, your person is fine.
So, how do you keep your heart healthy and what do you recommend for others?
I practice what I preach.
Okay.
I exercise every day, minimum 1 hour, at least 300 plus days out of 365 days. Only if I am traveling or
Even in
if
this
I'm
busy schedule.
absolutely, absolutely. And I do. around 2 hours of meditation practically every day. So total 3 hours I am keeping for
How do you
myself.
find time out for that?
My sleep is not more than 5.5 hours,
Okay.
because if you do proper meditation practice for 2 hours, it is equivalent to 3-4 hours sleep or 5 hours.
So that is what you recommend for others?
People may get tuned to it, people may not get, but in some or other form person should do some exercise. If one doesn't want to do a real cardio or weight training, at least you walk for an hour a day.
Every other day you see so many articles or news in newspapers, television channels, YouTube channels about youngsters dying of heart attack. Is this the time to panic?
It is a very, very disturbing phenomenon. Not only for the people living in our society, but also for the doctors who are treating these patients. It is a very, very disturbing phenomenon.
Okay. One last question, doctor. Like when we step out of the house, the first thing we ensure that we have a mobile with us, right? So sorbitrate is considered to be a life-saving
Not
drug.
at all. Not at all. Sorbitrate only relieves the symptoms.
Okay.
It has no mortality benefit.
Okay.
One drug which should be in your purse or in a pocket is soluble dispirin.
Okay.
When there, if you feel that this pain I have never experienced and is lasting for more than 5 minutes, you just put it in the water, dissolve it, and drink it.
And even if it has nothing to do with heart attack, it won't
It
have
won't
any side
harm you. It won't
effects.
harm.
So that was Dr. Tejas Patel. Keep watching Vibes of India for more such information. Thank you.